how are they doing? If you can identify the deceased by name, what is your husband's name? John, and talk about John. And then this is sort of your warning shot. You know, I want to bring these. I have some bad news to share. And that kind of prepares them. Education is key. Start where they end their story. So what I do in the ER a lot of times, like, what do you know so far? And I said, as you know, he was in a horrible car accident. The paramedics did the EMS crew did an amazing job. They put an airway in to breathe for them. They put an IV in. They gave medications to stimulate the heart. They did CPR, chest compressions. I kind of tell the story and then I end it there. And try to avoid jargon, so you don't want to say like, well, they put a I-gel in and gave 3 milligrams of epinephrine. Just very, very basic. Slow and steady if you can. If needed, you may need to fire another warning shot and let them know that it's some very devastating and bad news. And sometimes I'll do this with people who are really sick. Like a couple weeks ago, they brought a stroke patient in who was a fairly young guy, huge bleed on CT with shift and everything. And I basically described right away, I'm really worried about your husband, John. It looks like he's had a catastrophic amount of bleeding in his brain, and he may not survive this, that sort of thing. So that's that warning shot. Verify, be clear, don't use euphemisms. He's no longer with us. Where did he go to the hospital? Where did he go? What do you mean he's no longer with us? Passed away or passed on. Really try to use the word dead or death or died, because people understand that. The euphemisms, people get very confused, because don't forget, sometimes with denial, they don't want to hear this, so they're gonna create in their brain that means something else. Personal space is important. So it's really interesting. I've had patients that I'll put a hand on their hand. I've hugged people before. I put an arm around them. Some people just don't want to be touched. And for me, like I come from like a large Italian family, and they're very huggy and kissy and stuff. So I'm used to like hugging people and stuff. But some people are like, get the hell away from me, and that's totally fine. So just read the room and see where they're at, and it's totally fine for people to be alone. Silence is important. I mean, sometimes I've got a horrible experience, horrible trauma. Teenager died, and the only thing we can do in the room at that point is sit and be silent. There's really nothing to be said, and that's okay as well. And give them permission to cry, and it's okay you cry. It's normal human response to get emotional and cry. You don't want to be the like sobbing on the floor where you have to be comforted, but it's okay to have emotion. I mean, I think that's a real thing. Inquire, give me questions, try to answer their questions. I sometimes give them my card, or if you have any questions, I'll I'm working my shift till 11 o'clock, whatever it is, and listen for those hidden questions. Or so do. This is really good. I can't imagine how difficult this is for you. I know this is painful for you. It looks like people really care for her. I know you're feeling overwhelmed right now. Is there anyone that I can call for you, or anything I can do? This is all that sort of empathy. These are sort of the don'ts, referring as the body of the corpse. Oh God, I had a partner once years ago who'd be like, well, it was just God's will, and like you don't know the people's religious backgrounds or how they really feel. She's God, you just have to make the best of it. You need to be strong for your children. You'll get over this. Aren't you lucky that at least, and I know how you feel. That's important, because we really don't know how they feel. I know how I feel, but I don't know how they feel. Questions? It's sort of the nuts and bolts. Like, they always ask, well, what the hell do I do? What do I do now? And we often say, well, the police are going to be here. They're going to have some questions, take some info, and they're going to work on working with the medical examiner. Organ donation is interesting. It's tough in the hospital. We have referrals. We don't do a lot of this in the pre-hospital setting. Remember, with organ donation too, these are not people that they're harvesting their organs. Like, nobody's going to get a heart or a liver from people that die in the field.
Skin and tissue.
Yeah, it's like skin, cornea is really, really small stuff they might be able to get, but it's not. You have to be brain dead to go to an operating room. And just on a total aside, we had a remarkable silver lining recently, and we had two. This is a total tangent. It's nothing to do with this talk, but I think it's kind of cool. So we've had we know epinephrine, right? Does epinephrine improve outcomes in cardiac arrest? Yeah, especially asystole. So what they found with epinephrine is you can get ROSC and admit people to the hospital, but they don't make it out of the hospital alive. And so the question is, should we be giving epinephrine? I have an argument with limited data from Cheshire County that I don't know. We've had 3 in the last, actually 2 a week ago, Right before that, in the last few years here, where patients who were in asystole, got epinephrine, got ROS, were brain dead, and they went full organ procurement. We had 2 overdoses in a day 2 weeks ago in Keene. Both young people, unwitnessed, asystolic arrest, 20-30 minutes on scene, ROS, admitted, brain death. Both of them went to the OR for full organ procurement the same day. I mean, so that's a big deal. I think that's a win, you know. So.
And for us, the one that was done at Cheshire, it was the first time in 10 years that we've done it. So
the other one they sent out to Beth Israel because they were on dialysis and they did it there. But. Our fellows, if appropriate, they can view the body. But remember, all these other medical examiner stuff should be left to the medical examiner, law enforcement, and offer to call. You know, call somebody. And I always give your card, contact information, offer to answer questions, always return or take their call. We have, this is not an updated one, but we have tonight, if you need more of these are bereavement packets. I would put like at least 1 or 2 in each ambulance. And what we do is, we terminate resuscitation, and then this is something you can leave for the family. It has some information on grieving in there, sort of what to do next sort of stuff, and there's a condolence card in there. So I don't often say, let's go back to the station and fill this card out and mail it to them. We usually just fill this out on scene. And what I like to do often is, after a code, after a code, we terminate resuscitation. We're often either in the room without family or outside putting stuff back together, or you do a really quick debrief outside. What went well, what didn't go well, what can we do different next time, quick debrief for your team, and then you just pass the card around and fill it out and leave it with them. It's just a nice little kind of gesture.
And just leave the envelope on the inside and bring the sleeve back so that I can replace it for you.
Yep. And these are the sympathy cards, that's part of that as well. And you can get creative. Doug, many years ago, this was a SIDS death that he was on scene, and the parents were really super religious, and they were devastated that the kid wasn't baptized, and he was like, I'll baptize your kid. So he he's knew enough about this process that he put water and said a prayer and had the family there and just kind of gave him a certificate just to have so they can have something, which is I think pretty remarkable. Just put that, did that for them. All right, so in summary, this is a skill. It does take practice. Try to prevent family presence during CPR, relieve that survivor guilt. Tell people directly what's going on. You got to be honest. Encourage time to the seats and answer the questions as best as possible. That's it. Questions? That's it. No questions at all. Anybody have some really positive experiences?